Welcome back to my channel, The Life in the Womb. In this session, I will be dealing with the topic Pharyngeal Apparatus or Branchial Apparatus. And this is one of the favorite questions for almost all the examiners, especially for UG examinations. So, I will be dealing with this topic in two sessions. In this session, I will be covering almost 3/4 of the topic, and the remaining I will be doing in the next session. So before moving on to the topic proper, I would like to say something about the three germ layers. You know that there are three germ layers in our body. They are the ectoderm, mesoderm and endoderm. So what is this pharyngeal apparatus or branchial apparatus? So in the up to 4th week of intrauterine period in an embryo, there is no neck formation, and this apparatus is actually formed during 5th and 6th week of intrauterine period. So what happens is, when you talk about the apparatus, you should think about three important derivatives. That is, it has got a mesodermal core, it has got an ectodermal lining, and it has got an endodermal lining. So all these three together forms the pharyngeal apparatus or branchial apparatus. Why this is called pharyngeal apparatus? This is actually forming the floor of the pharynx. So the primitive pharynx, the floor is actually supported by the pharyngeal apparatus. So when you talk about the components, we said about the ectoderm, the endoderm and the mesoderm. So when you talk about the pharyngeal apparatus, the pharyngeal arch, when you mention about the pharyngeal arch, it is just the mesodermal core. Mesodermal core. So pharyngeal arch means it is the mesodermal core. So where will you get this pharyngeal arch? So in the posterior aspect, you have the hindbrain vesicle, and from the hindbrain vesicle in the neck region, two halves of the arches come forward. You can see the two halves of the arches which are coming forward from the hindbrain vesicle. From the region of the hindbrain vesicle, you can see two halves of the pharyngeal arches coming forward, and this is the midline, the ventral aspect. This is the midline, and they both meet in the ventral aspect. So how will you see an arch now? You will be seeing this arch as a horseshoe shaped structure, because from both sides these halves will be meeting in the midline in the ventral aspect. So if you consider this as an arch, these arches will be actually arranged in the neck like this. Understood? So you have almost 6 pharyngeal arches in the neck region of the developing embryo. So the arch means it is the mesodermal core. And I have already mentioned that the pharyngeal apparatus is made up of mesoderm, ectoderm and endoderm. So the outermost covering will be the ectoderm. So the ectoderm will be covering this mesodermal core. And where will you get the endoderm? Here is actually the pharynx, isn't it? So the pharynx will be lined by the endoderm. So the innermost aspect will be lined by the endoderm. So outermost covering will be the ectoderm and innermost lining will be the endoderm, and in the core it is actually cylindrically arranged mesodermal core. Altogether you call it as pharyngeal apparatus, and likewise you will get almost 6 arches which are arranged in a horseshoe shaped manner in the neck region, and out of these 6 arches, the 5th one usually disappears, and ultimately you will get the derivatives from the 5 major arches. So that is what is meant by pharyngeal arches. So pharyngeal or branchial apparatus, it is an apparatus seen on the ventral aspect, and it is made up of 3 components: the ectoderm, the mesoderm and the endoderm. When you talk about the arch, it is the mesodermal core which are cylindrically arranged, and from the outer aspect it is covered by the ectoderm, and from the inner aspect it is lined by the endoderm. You have 6 arches in the neck region, and out of these 6 arches, 5th one disappears, and ultimately we will be discussing about the derivatives of the 5 major arches. Now, when you take a section, in this session, I will be mainly dealing with the pharyngeal arch derivatives, and the ectodermal and endodermal derivatives we will be discussing in the next session. So, this is actually as you look from the side. If you just take a cut section here, this is how it will look like. So, if you consider this as the first arch, cross section of the first arch, here you have the second arch. Can you make out? So this is the first arch and this is the second arch. So from the outer aspect, you can see the ectoderm covering. And the ectoderm actually dips into the groove, and again it covers the next arch. Again it dips into the groove. Again it covers the next arch, like that it goes. And from the inner aspect, you have the endoderm. So the endoderm will be actually covering the inner aspect. It will be dipping into the groove. Again it will cover the next arch. It will be again dipping into the groove. Like that this will go. So the dipping of the ectoderm, here you call it as ectodermal cleft. So the dipping of the ectoderm in between the arches, you call it as ectodermal cleft. And the dipping of the endodermal lining, you call it as endodermal pouches. Endodermal pouches. So the derivatives of ectodermal cleft and endodermal pouches we will be discussing later. In this session, we are concerned about the pharyngeal arch alone. So pharyngeal arch means it is the mesodermal core. So you can see the 6 arches arranged in the neck region, out of which the 5th one will degenerate, and we will be discussing about the derivatives of the 5 major arches. So if you take a section of the mesodermal core, what are the derivatives you will be getting in the mesodermal core? Actually, from the mesodermal core, you have many elements. One is the skeletal element, then you have the muscle of the arch, then you have the vessels of the arch, then you have the nerves of the arch. So these are the major derivatives which you will be getting from each mesodermal core of a pharyngeal arch. So let's see one by one in detail. So before moving on to the detail, why you need this pharyngeal apparatus, or what are the major structures derived from the pharyngeal apparatus? This apparatus is actually responsible for the formation of face, for the formation of mouth, for the formation of pharynx, for the formation of neck, and also for the formation of larynx. So these are the important regions of the body which are derived from the pharyngeal apparatus. So now we will be moving on to the pharyngeal arch, the derivatives of the pharyngeal arch. So when you take a cross section of the pharyngeal arch, these are the derivatives which you will be getting in each arch. So first one, we will be discussing about the skeletal elements of the pharyngeal arches. So skeletal element, let's see one by one in detail. So in the mesodermal core, you have a cartilaginous plate. Okay, so in the mesodermal core you have a cartilaginous plate which will be later ossified to form the bone of each arch. So let's see what are the derivatives of the first pharyngeal arch. So before moving on to the derivatives, I would like to add 2 more points, that is, this is the ventral part and this is the dorsal end. These terminologies you need to know when we discuss about the ectodermal cleft and endodermal pouch in detail. So this end, the anterior facing end, this is the ventral end of each arch, and the posterior end is the dorsal end of each arch, and each arch has got 2 borders. Can you see the 2 borders? The one which is more closer to the head, you call it as the cranial border, or the upper part you call it as the cranial border, and the lower part you call it as the caudal border. So cranial border, caudal border, the posterior end you call it as dorsal end, and the anterior aspect you call it as ventral end. Now we will move on to the skeletal derivatives of the arches. So the first arch, let's discuss about the first arch. So first arch has got 2 processes. One is the maxillary process and the other one is the mandibular process. The maxillary process is actually responsible for the formation of the upper lip, the upper jaw and the palate. You have the upper lip here, you have the upper jaw here and you have the palate formation here. And this maxillary process is actually separating the nasal cavity here from the oral cavity. Okay, so that is about the maxillary component of the first pharyngeal arch. There is one more component in the first pharyngeal arch, that is the skeletal derivative of the first pharyngeal arch. The one more component is the mandibular component. And in the mandibular component, you have a cartilage in the beginning. That is known as Meckel's cartilage. Meckel's cartilage. So what happens to the Meckel's cartilage? So Meckel's cartilage, in some region it will ossify to form bone and the remaining portion will be actually degenerated. And if it is not getting converted into bone and if it is not degenerating, sometimes it will be seen as a ligament as well. So when you discuss about the skeletal derivatives of the first arch, the mandibular component, first we will discuss about the bones formed from the Meckel's cartilage, which is the cartilage of the first arch, and the ligaments derived from it. So what are the bones formed? When you look at the dorsal aspect, you can see two important bones, the ear ossicles. One is the malleus and the other one is the incus. So out of the three ear ossicles, the malleus and incus are actually derived from the mandibular component, that is the Meckel's cartilage. And the remnant of the Meckel cartilage is actually forming the mandible, the body of the mandible. And in between these bones, you can see the degenerated portions of the cartilage in the form of ligaments. So which are the ligaments? One is the anterior ligament of malleus and the other one is sphenomandibular ligament. These are the two ligaments which are seen in the first pharyngeal arch. So these are the skeletal derivatives of the first pharyngeal arch. Now let's move on to the second arch. What are the second arch derivatives? So first arch you can call it as mandibular arch, since mandible is the major component in that region. The second arch is known as hyoid arch. Why is it called hyoid arch? Because again the hyoid bone is a major component in the second arch. So only these two arches are actually named arches. First is the mandibular arch and the second one is hyoid arch. If you want to remember the derivatives of the second arch or the hyoid arch, you can remember the mnemonic, like it is second, isn't it? So the first letter is S. So most of the derivatives you can club it under the letter S. So what are the derivatives of the second arch? So before moving on to the derivatives, the cartilage of the second arch is known as Reichardt's cartilage. Reichardt's cartilage. Okay, so again only the first and second arch has got its own named cartilage. The rest of the cartilages are not named cartilages. So the second arch, the cartilage is known as Reichardt's cartilage, which will be ossifying to form the bones. So let's see what are the structures starting with S in the second arch. So from the posterior aspect, if we begin, this is the stapes. So out of the three ossicles, ear ossicles, the third, the stapes, is actually a derivative of the second arch. Then which is the next process? Again starting with S, this is the styloid process. So stapes, styloid process. Then which is the next component? You have the stylohyoid ligament, the ligament which connects the stapes with the hyoid bone. Then the next component is the small horn. The small horn of the hyoid and the superior part of the body of hyoid. So these are the skeletal elements derived from the second arch. Stapes, you have the styloid process, the stylohyoid ligament, the superior horn of the hyoid and the superior aspect of the body of the hyoid bone. So these are the derivatives of the second arch and all starts with the letter S. Now coming to the third arch. So third arch in the posterior aspect, the most of the third arch is actually getting degenerated, and when you come to the anterior aspect, you can see the greater horn of the hyoid bone along with the rest of the body of the hyoid bone. So the greater horn of the hyoid bone along with the rest of the body of the hyoid bone is actually a derivative of the third pharyngeal arch. Now coming to the fourth arch, it is mainly the thyroid cartilage, and you will also get the cuneiform cartilage, the laryngeal cartilage from the fourth arch, and fifth arch usually disappears. So some others prefer to include the development of the thyroid cartilage as from fourth and fifth arch. So usually we say that the thyroid cartilage is derived from the fourth pharyngeal arch. Now fifth usually degenerates, and there is no major derivative from the fifth arch, and the sixth arch will give rise to the remaining laryngeal cartilages. Which are the remaining laryngeal cartilages? They are the cricoid, the arytenoid and corniculate. So this is about the skeletal derivatives of the pharyngeal arches. Now let's see about the muscles of the pharyngeal arches. What are the muscles of the pharyngeal arches? So muscles of the pharyngeal arches are actually formed in and around these bones, and once you have finished about the detailed structure of the head and neck, you can just remember the muscles seen in relation with these bones. So let's take the first arch first. So what are the muscles seen in relation with the first arch? You can see tensor tympani, tensor veli palatini. Then the main one are the muscles of mastication, anterior belly of digastric and the mylohyoid muscle. So these are the muscles formed in the first arch: tensor veli palatini, tensor tympani, muscles of mastication, anterior belly of digastric and the mylohyoid muscle. So though they are formed in this along the first arch, in course of time they will migrate to their original position except for the tensor tympani. Tensor tympani will be seen attached to the malleus and it will remain in its previous position, whereas the rest of the muscles will migrate to its adult position. What are the muscles seen in relation with the second arch? The second arch muscles, again, some of them start with S. Which are they? It is the small bone or the ear ossicle which you get in the second arch is the stapes. So the muscle attached to that is stapedius. Then you have the styloid process. Then you can call the muscle attached to it as styloid process. Then the other muscles are the digastric muscle, the facial muscles and the platysma. So these are the muscles derived from the second arch. Now coming to the third arch, you have only one muscle, that is the stylopharyngeus muscle. So the third arch you have only one muscle, that is the stylopharyngeus. And what about the fourth arch? Again one muscle, that is the cricothyroid muscle. It is the only intrinsic muscle of the larynx which is seen externally. So that is a cricothyroid muscle which you will be getting in the fourth arch. And what about the sixth arch muscles? Sixth arch muscles are the muscles in relation with the larynx, the intrinsic and the extrinsic muscles of the larynx. So the sixth arch you will be getting the laryngeal muscles. So these are the muscles which are derived from these arches. The next component is about the vessels. When you talk about these arches, this should be nourished by the vessels, isn't it? So in the beginning, this is the ventral aspect. You have the aortic sac here, and posterior aspect you have two aortae, dorsal aortae. Okay, so in the ventral aspect you have an aortic sac, and in the dorsal aspect you have two dorsal aortae. So these two components are connected along the arches. Understood? You have the dorsal aortae and you have the ventral aortic sac. So these two are connected by aortic arches, and these aortic arches will be running through each pharyngeal arch. So I will be taking a detailed session about the derivatives of the aortic arches. For the time being, let's see what are the remnants of the aortic arches seen in relation with each pharyngeal arch. So the first aortic arch, the remnant which you get after development is the maxillary artery. So it is a maxillary artery seen in relation with the first pharyngeal arch. What about the second aortic arch? The remnant which you get in the second aortic arch is the stapedial artery. What about the third arch? The third arch, the aortic arches remaining are the common carotid artery and the internal carotid artery. About the fourth arch, you have on the right side, it is the right subclavian artery, and on the left side, you have the arch of aorta formed. So, right side you have the right subclavian artery, and on the left side you have the arch of aorta formed. And what about the sixth aortic arch? You have the right and left pulmonary arteries, and on the left side again you have the ductus arteriosus. So, these are the vessels which are derived from each arch, or you can say in a better way, that is the aortic arches which were running through each pharyngeal arch, the remnant of it is seen in these forms. Once again, in the first arch you have the maxillary artery as a remnant of the aortic arch. Second arch you have the stapedial artery. Third arch you have the common carotid artery and internal carotid artery. Fourth arch you have on the right side you have the right subclavian artery, and on the left side you have the arch of aorta, and the sixth arch you have the right and left pulmonary artery along with the ductus arteriosus. So we have covered about the skeletal component, we have discussed about the muscles attached to the skeletal component, we have discussed about the vessels running through each arch. Now what is the most important thing? You have the muscles and you should have the nerve supply for these muscles. So before moving on to the nerve supply, I would like to say, here we discussed about the first arch. This is the first arch, and there is a dip, isn't it? And then you have the second arch. Like that this goes. Then you have again a dip, and then you have the third arch. So you might have heard about pre-traumatic and post-traumatic nerves. So what is meant by tremor? Tremor, the word meaning is the ectodermal cleft. So when a nerve comes in this region, this will be divided into a pre-traumatic nerve and a post-traumatic nerve. Okay, this one nerve, when it enters through this tremor or the ectodermal cleft, it will be divided into a pre-traumatic nerve and a post-traumatic nerve. Pre-traumatic nerve will be running along the caudal border. I have mentioned about the cranial border and caudal border for each arch, right? So this is the cranial border and this is the caudal border. So each nerve, the pre-traumatic component will be passing through the caudal border, and the post-traumatic one will be running through the cranial border of the succeeding arch. That is how each nerve will be entering. But in human beings, you have only the pre-traumatic nerve for the first arch, whereas the rest of the arches, all the pre-traumatic nerves will be actually degenerated. So only the first arch will be having both pre-traumatic, traumatic and post-traumatic nerve. Pre-traumatic and post-traumatic nerve, whereas the rest of the arches you have only the post-traumatic nerve. So let's discuss about the nerves in each arch. Now since you know the muscles of each arch, it is very easy to know the nerves of each arch. So let's discuss the first one. First one, the nerve of the arch is the mandibular nerve. You know the muscles of mastication, everything is supplied by the mandibular nerve. So it is the post-traumatic nerve of the first arch, mandibular nerve, and the pre-traumatic component is actually the chordae tympani. Chordae tympani is the pre-traumatic nerve of the first arch. So if you just think about the facial nerve entering into the cleft, you can see that the pre-traumatic nerve will be running along the caudal border of the first arch, and the post-traumatic will be running along the cranial border of the second arch, isn't it? So it is the chordae tympani which is the pre-traumatic nerve of the first arch, and what is the post-traumatic branch? It is the facial nerve. Okay, so it is the facial nerve. So the second arch nerve is the facial nerve, and you can see the second arch muscles, isn't it? The muscles of facial expression mainly, you can remember like that. So the second arch, the nerve of the second arch is the facial nerve. What about the third arch? This is the third arch. What is the muscle of the third arch? Stylopharyngeus. So this is supplied by glossopharyngeal nerve. isn't it? So glossopharyngeal nerve, only one motor supply, that is to the stylopharyngeus. So the third arch nerve will be the glossopharyngeal nerve. And what about the fourth arch? Let's see the fourth arch muscle, that is the cricothyroid, the only intrinsic laryngeal muscle which is seated externally. So what is the nerve supply to that arch? That will be the external laryngeal nerve. External laryngeal nerve, which is a branch of superior laryngeal nerve. Superior laryngeal nerve again is a branch of vagus. And what about the sixth arch? Sixth arch, you can see the muscles of the sixth arch are the laryngeal muscles. So which is the nerve supplying all the intrinsic muscles of larynx? That is the recurrent laryngeal nerve. Recurrent laryngeal nerve, again it is a branch of vagus. So all these cranial nerves, which are the main cranial nerves? You have the fifth nerve, that is a trigeminal, from which you have the mandibular nerve. Then you have the seventh nerve, you have the facial nerve, which is giving actually the post-traumatic branch to the second arch, and again pre-traumatic branch to the first arch. Then you have the ninth nerve, the glossopharyngeal nerve, and you have the 10th nerve, which is giving the superior laryngeal and recurrent laryngeal nerve. So all these nerves 5, 7, 9 and 10 are actually coming from the midbrain and the hindbrain vesicles from the posterior aspect, and they will be running through the pharyngeal arches from the posterior to the anterior, from the dorsal to the ventral aspect. So in a nutshell, you have learnt about the components of the pharyngeal arches in detail. You have a skeletal component which are derived from the cartilages, which are getting ossified either by intramembranous or intracondylar ossification. Then you have the muscles attached to each skeletal element. Then you have the nerve supplying it, and you have the arterial arches which were running through each arch, and the remnant of the arterial arches which you get after the development. So these are the derivatives of the pharyngeal arches, which is just one component of the branchial apparatus. And in the next session, we will be discussing about the derivatives of the ectodermal cleft and the endodermal pouch, because only with the ectodermal cleft and endodermal pouch, the entire thing, the branchial apparatus, will be complete. We will be discussing about the some of the applied aspects of the branchial apparatus as well in the next session. So you know what to do. You can click the button if you want to get further notifications about the sessions going on. So please do like and share your comments, and please do subscribe. Thanks for watching.